Welcome to the Two Disabled Dudes podcast. We believe life is about how we react. What up, what up? Welcome to the Two Disabled Dudes podcast.
You always impress me with your creativity. You have an endless supply of ridiculous openings.
That's right. This episode is brought to you in part by Reata Pharmaceuticals. Sean, a couple weeks ago, I participated in the 5-borough bike tour with a few teammates for the Friedrich's Ataxia Research Alliance. It started in downtown Manhattan.
Nice.
And it went uptown and then through like Queens and the Bronx and all the way down to Staten Island. Wow. And there was 30,000 people in the ride.
My goodness.
And there were 6 of us.
Jeez. Yeah, wow.
That
was your first time doing it? I've never heard of this one.
Yeah, that was my first time doing it. It was their 45th annual, I believe. And so they've got it down to a science. You know, all the obstacles were marked really well so we could see everything. I remember there was this huge pothole so big that they had someone standing in front of it with a flag so nobody got swallowed up in it.
Wow. That's insane. How cool is it, though, to ride the streets of New York like that?
At the start line, we're just riding down the middle of the street. And then at the end of the day, when we drove out of the city, we drove down that same road. And we're like, wait, we were just riding our bikes here this morning.
That's nuts. That's cool. I saw the pictures. It looks fantastic. Glad you and a team were able to be a part of that. That's cool.
Absolutely.
The following message is brought to you by Reata Pharmaceuticals.
I bet you can't guess what I'm thinking of.
How many guesses do I get?
3.
Okay. Deal. But honestly, I think I can get it in 1. I bet you're thinking about Friedrich's Ataxia Awareness Day and how it's right around the corner.
You're literally in my brain, and that's weird.
Well, yes, but it's been on my mind too. It feels like May 20th is a special FA Awareness Day for the FA community because we finally have a treatment option.
You're so right. I mean, Skyclarys omavaloxolone 50 milligram capsules is the first and only FDA-approved treatment for FA for patients 16 years and older. This is so exciting for the community.
If you or a loved one has FA, be sure to talk to your doctor to see if Skyclarys is right for you.
And to keep up with all things Skyclarys, visit skyclarys.com.
Before taking Skyclarys, tell your healthcare provider about your medical conditions and medicines you take. Skyclarys may cause serious side effects, including an increase in liver enzymes in your blood, increase in a blood protein which tells how well your heart is working, and changes in cholesterol levels. Your doctor will test these levels before and during treatment with Skyclarys. The most common side effects of Skyclarys include increased liver enzymes, headache, nausea, stomach pain, tiredness, diarrhea, and muscle pain. Call your doctor if you have any side effects. For additional information about Skyclarys, please see the full prescribing information and patient product information at www.skyclarys.com. This ad was brought to you by Reata Pharmaceuticals.
Well, throughout Season 9, we've been sharing a focus on mental health, and we're wrapping up the month of May, Mental Health Awareness Month, with some incredible guests. You've already heard Shelley Bowen twice. We are honored to have her on again as somebody that has spent years working on behalf of the rare disease disabled community and parenting 2 children that also had a rare disease, and she's an incredible resource to people that know her and are connected to her, and we're honored to be a part of that mix. So Shelley Bowen joins us again today to talk about the value of therapy. We all recognize that there are 1,000,001 reasons why you might seek professional help. And what I enjoy about this particular season and this segment is just dealing with it in the ways we know how. So once again, we've got Shelley Bowen coming back to help us kind of navigate what that might look like if and when somebody decides to seek out professional help. Shelley, welcome back.
Thank you for having me. I appreciate it.
We talk about it all the time. Maybe you need therapy, maybe you need a counselor or professional help, maybe you don't. Let's focus this conversation on pursuing that professional help. Shelley, what's your take on where a therapist comes into play in somebody's life?
Well, I think everybody needs a therapist, right? I think everybody needs a mental health therapist, just, if nothing else, just to, help you talk through or think through incomplete notions, to try to put it in a package where you can understand things a little bit better. Whether it's grief in terms of a diagnosis, grief, loss of somebody you love, grief over a loss, period, grief over a reality or a truth that you have just found out. I think we all need a little bit of help. And there is no shame in going to a cardiologist, a neurologist, an endocrinologist, right? But you wouldn't tell somebody, yeah, I've got a really great therapist that I see. I mean, not often do you hear that conversation come up.
Right.
And it's just, I think it's really important, if you have a situation in your life where you are living with a condition that may be life-altering or progressive, life-threatening, or if you are the parent of somebody, because parents deal, when your spouse and you deal with things differently. And that's sometimes frustrating, right? Because you expect your spouse to be in complete harmony with the way you're processing things, but they're not. They're thinking it through, and you can't lean on somebody who's going through grief. Otherwise, they're going to topple, because they're trying to put it together in their own head about how to just go to work every day so you can keep insurance. It's not that they don't care. It's just that they're dealing with different things in their own mind than you are. So having a conversation about that facilitated is really helpful, because you don't think that spouse is losing it, for lack of a better term, so you just to have somebody facilitate a conversation is really important.
Yeah, to have like a third party that doesn't necessarily have a stake, so to speak, in the situation is really important. I feel like it's just nice to say things out loud to really understand the way even you think about them, right? And sometimes you say things out loud and you're like, I can't believe I think that, but all right, maybe I need to change something or think about things differently. And it's really valuable, I think, to have that third party to hear that stuff.
Yeah, that's true. That's true, Kyle. And I think just saying it out loud, as you said, without a third party, with somebody who's not, that's not in your everyday world, because people in your everyday world want to fix it. They want to make it better. And you don't necessarily need to be fixed. You just need to understand, where is this coming from, And you're right. Yeah. Just having, having that moment of just being able to say it out loud. And maybe you just needed that safe spot, to do that.
Yeah.
Shelley, you mentioned there typically isn't any shame in choosing a cardiologist or going to see a podiatrist or whatever might be needed. Why do you suppose there's shame around going to find counseling or therapy?
I honestly, I think it's an American thing. I talk to people in other countries, and they're open about it. They're open about mental health and taboo subjects that we, in America tend to have. I mean, the fact that there's a max for insurance to pay for mental health counseling just goes to show how diminished the appreciation is for one's mental health. And your head is attached to the rest of your body. So it stands to reason if you have, I mean, anxiety kills. My mom died of stress-induced cardiomyopathy. Stress kills. That saying is really true. So, we need to be open about it and not just suppress it, because it becomes just this cancer that grows. And I think there's something that a friend of ours is a licensed social worker that works with teens and with married couples, and he said that he had an observation that finding the right counselor is like dating, like those dating apps, right? You think about it, you're going to go to a counselor, you're going to be talking to them, you have to have trust in them or your rapport with that individual, and you may not find the right counselor on the first date, just like you don't find your life mate on the first date, when you're so there's no shame in going to somebody different. So knowing if you click with that person and going to someone else. And I think with kids, I believe that as they change, pediatrics is not the same as adult medicine. Transitions, is something that we talk about a lot too. And there's a lot of changes that happen between the age of 10 and 25, right? There's a lot. So you're not going to do play therapy when you're 25 with the therapist that you were, started with when you were 10. So, knowing that there's going to be, you may change or you may outgrow a therapist, and having a conversation with the therapist about who you might transition to. And the therapist isn't going to take it personally that you don't fit. They're going to get it. If they're a good therapist, they're going to get it. And so I believe that there comes a natural point in someone with a rare disease. I believe it comes a point where the reality sets in. A child is used to going to the doctor. They just know they go to a doctor a lot. They don't know why. They know they have this condition that has this name. They don't understand the gravity of it. But at some point, that reality sets in. Developmentally, a child isn't even aware of their own mortality till around 10 or 12. So there are questions and concerns that are brewing in their head, and I think it's important to pay attention to one's mental health that has the condition and one's mental health who is with that person, because you need help too, because this is your first time in the rodeo, of raising a child with special needs. So I think finding that right person before the need comes up, it's kind of like we talked earlier about the hard discussions about having those discussions about end of life decisions. I think during life decisions is just as important to talk about is, while you're living with it, what are you going to do about it?
Would you have any recommendations or suggestions? Couple things people might consider when, quote unquote, shopping for the right therapist. How do you encourage somebody to, what are some things that might be helpful in identifying this might be the right one?
Well, you can, I was going to say, now I'm aging myself. You can go to the yellow pages, but I don't even think that's existing. But a good thing is that if you are connected with a rare advocacy group, chances are there's somebody in that group and that has worked with a therapist. And now with the age of Zoom, virtual meetings are available. And like us, in the rare disease community, we kind of know a person and know somebody who lives in California or know somebody who lives in South Carolina where the turkeys are, so we can say, do you know somebody good there? And that is your first start. And just because that counselor was good with that person doesn't mean they have to be the right person. But if you have a meeting with that counselor, then you can always get a referral to someone else if it doesn't work out.
Sure.
So the first step, and they may say, there's somebody else in our practice that I think would be better fit for your family. Mm-hmm. So I think making that first decision that, what is it going to hurt? What is it going to hurt?
Sure.
To talk to somebody who is a pro, it's not going to hurt anything to have a conversation with somebody. And then you're established. And then you don't have to wait for 8 weeks to get in when your kid is like wallowing in the floor because all of a sudden they just realize that they have a condition that could claim their life, or they, whatever struggle they have been internalizing, or they suddenly all has just come caving in on them. Having that person to go to and having that person for you to go to talk it through is really important because you need help in raising that individual and that individual needs help going through it. So that's one thing that I would recommend.
That speaks to putting that support in place before it's needed. Mm-hmm. Because you don't want to be trying to choose the right therapist when you're in crisis, right? You want to be able to go to that right person and address the issue right away. Well, one of the things that you've told us is just to be able to get that support in before it's needed is one of the most important things.
It is. And you go to the cardiologist when you're well, right? You go because you have a baseline and they can see if things are changing. And so then there's something that can be done and this has changed and we need to tweak this. Same thing with mental health therapy, so check with the rare disease group that you're working with. Chances are they have mental health people there and they have professional groups and they know your condition and they can make a referral. That's a really great way to find somebody who can refer you. You can also talk, if you go to church, you can talk to somebody, you can talk to your pastor about somebody who is, or your rabbi about somebody who's really good. If you have trust in that individual, but going to somebody you trust and asking them if they know a therapist is really a good start too.
I think we've heard it before, right? Referrals are probably the number one best way to find somebody to connect with. It may not be that first referral, but then it just starts. And I think it's worth repeating, Shelley. What I'm hearing you say is just start the process. Mm-hmm. Once you start looking around, it's gonna, maybe you're fortunate. Maybe it is the first date and you hit the jackpot, but maybe it's gonna take 3, 4, 7, 20 different consultations before you're really comfortable. And at that point, you've got something rolling. So I appreciate hearing those words, and I'm hopeful and I believe that many of our listeners are gonna find these words encouraging. So again, I am so grateful that you agreed to come back and share some more about your own journey.
Well, I'm grateful for you too. And I'm going to one of these days do an interview with you and put you in the
All right. That's fair.
The challenge is on, dude. The challenge is on.
We find it unfortunate that there is so much stigma around mental health and seeking mental help. There should not be shame attached to getting well or just staying on a healthy track emotionally and mentally. We encourage you to utilize your resources, seek help, and perhaps that's a professional. Perhaps that's just somebody in your life that you trust. Whatever the case, we believe there is power in just talking things through and bringing things to the surface. We hope that you have people in your life that you can do that with. We encourage you to foster those relationships. Whatever you're up against, remember, you got this.
Sean, a few years ago, you broke your femur and you were in Pennsylvania. It was a long road to recovery before you could get home. Did you have good experiences with physical therapy?
In-house PT in Philadelphia or Pennsylvania, wherever it was, that was phenomenal. The most interesting PT I had was when I came back home. I continued PT. Sometimes they would come to my house. Sometimes, when they got better, I'd go to them. Well, when it was time to transition where I went to them, I don't know, twice a week, the first place I was referred to, I couldn't get in the building because I was still using a manual wheelchair, and all of their doors were like turn the handle, pull open doors, which I wouldn't say is impossible in a wheelchair,
right?
But it is really inconvenient. So I remember this one in particular where I felt like I put in a lot of energy just to get to the front desk. And I asked, I'm like, what is this about? She's like, oh, well, I don't know. But anyway, your therapist will be right with you. I'm like, I'm good. I'm just going to find the note. And I left. I was like, I'm not going to do this every week. So anyway, I certainly can understand there are probably horror stories. And there are not. There are some amazing experiences. What about you?
Yeah, I've done physical therapy a few times, and I've had good experiences and bad experiences, but Sean, people don't want to hear about this from us. I'm telling you, people want to hear from Dr. Gretchen Hawley.
You're right.
Enjoy our conversation. Dr. Gretchen, welcome to the Two Disabled Dudes podcast. We're so excited to have you.
Thanks for having me. I've been excited for this conversation.
Can you tell us about yourself and what you do?
Yes, so I am a physical therapist and I specialize in helping people with multiple sclerosis. The reason that it's different is because people with MS have weakness, but it's not the same type of weakness as someone who just had an injury. It's more neurological. And so because of that, I also have treated a lot of patients with other neuro or autoimmune-based diseases as well. So things like Parkinson's, psoriasis, even arthritis, just so many different things. And so I help people get stronger, improve mobility by strengthening their muscles and their neural pathways.
Do you do any, quote, normal physical therapy, or do you focus on people with conditions like you just mentioned?
At this time, I wouldn't say I do any normal, or the word that I like to use is like orthopedic or traditional.
Okay,
when people think of physical therapy, usually it's traditional PT or orthopedic. So it's the place where you would go if you just had a knee injury or back pain, neck pain, shoulder, after a hip replacement or knee replacement. And physical therapy is great for those with an orthopedic approach. And I don't know if you guys have experienced this, but when you have anything other than an orthopedic injury, orthopedic PT that really doesn't help that much, or it can, but only to an extent. And then you keep plateauing and then you just aren't getting any stronger or improving your mobility any further. So right now, all of the work that I do, virtual and in person, is more focused on the neuro approach rather than just orthopedic.
Can you tell us how or why you went that route?
Coincidentally, I actually grew up in an area where MS is one of the highest rates of prevalence in the entire United States. But growing up, I actually didn't know anyone with multiple sclerosis. It wasn't until I went to PT school, I graduated, I had a job at an orthopedic PT clinic, and the clinic noticed that there was a high rate of MS in the Boston area. And they wanted to start a clinic for that because there wasn't anything like it around. And I was really, really nervous to go into it because neuro is like its own world. There's so much that goes on. Orthopedics to me seems easy. Like, all right, muscles, got it. But when you involve like the nerves, the brain, all the neural pathways, it is intricate. So I was definitely nervous, but so interested. And so I offered to dive into this. And in doing so, I started treating 2 people with MS. And one thing I noticed immediately is how different those 2 people were. Their symptoms were vastly different from one another. And not only that, but even each individual had different symptoms every single day that I saw them. And I thought that was fascinating. My favorite part about being a PT is the brainstorming. And right away, I could tell that this is a diagnosis where I have to stay on my feet. I have to stay up to date with research. And so then that's when I decided to not only start this MS program, but become an MS specialist and go through all of that training and tests and all of that.
Wow. Is there an aspect of it where you've got to try to get in someone's head and figure out what they're feeling so you can figure out what the best thing is for that individual person? Like you said, you treated 2 people and they were vastly different. So how do you deal with that when you're like trying to, be very specific to that person?
One of my favorite compliments that I get quite frequently is how well I understand MS for not actually having it myself. Because to me, that means like, okay, I am listening enough to the point where I do my best to understand. Obviously, I'll never understand what it feels like, but I can understand what it can feel like, and different approaches and treatment strategies can help those things. And it really, really requires truly listening, not only listening to what people are saying, but what they're not saying and how it's actually impacting their lives, and approaching it with a more functional approach rather than just treating the symptom. We never just want to treat the symptom. We want to treat the cause. And so sometimes the cause is MS, in which case that might actually require medication or supplements or other types of therapies. But a lot of the time, the cause isn't just MS, it's something else. Maybe it's fatigue or lack of sleep or spasticity that's so draining, and that's why you're more fatigued. So it's that approach of not just chasing the symptoms, but trying to figure out what might be causing it and going from there.
You've talked about being familiar with the condition and people saying you understand. And I imagine we have listeners right now that are saying, gosh, I wish my doctor were that way. Or, anybody in our care circle. So I'm wondering, I'm putting you on the spot a little bit. Was there a patient or a set of circumstances early on where you were like, this is it, I'm going to go all in and do an MS program? What was it that triggered that? Besides being prevalent, was there a person or a set of circumstances that convinced you were on the right track?
I'm a very visual person, so I can literally picture this exact situation that I'm about to paint for you. So it was one of those first 2 clients I just mentioned to you, how she was so different from this other patient. And I remember we were in the PT clinic, and one of my favorite things to do, the very first question that I ask with all of my clients is, what goals are you working towards? And not only that, but we get really specific. So a lot of my clients will say, I want to improve my walking. And so I try to dig deeper, like, what about your walking? Do you want to walk longer distances? Do you want to be able to lift your leg up when you're walking? Is it your balance while you're walking? And most of the time people are like, yes, all of that. But this one patient in particular, she wanted to improve her walking, but she said she wanted to improve her standing mobility. She wanted to stand for longer. And I said, okay, why? And she was about 24 years old at the time. Wow. And when I asked her why, she said, so that I can go to the bar with my friends and stand up. I'm getting chills as I think of this. Stand up while I'm ordering a drink and stay standing if there's a line. And at the time, I was also around the age of 24. And I was like, oh my goodness, this is not just MS affecting her like, I don't know, strength, mobility. It's affecting her day-to-day life. It is affecting the way that she participates and moves around in life. And as soon as she said that, I was like, this is what I need to do. She doesn't have another resource or another option of someone helping her to achieve these goals that so many people just take for granted. And then ever since then, I just really listened for those types of goals. So I've had other patients tell me they want to walk into the pizza shop to pick up the pizza, not just get delivery because they have to, not just because they're like running late and they need to, but they physically can walk in, or they want to walk in the grocery store without people thinking that they're drunk because of their lack of coordination. And so the goals like that are the ones that really make me feel like, yes, I am here. I am the person that can help when there's so few of us that can.
Yeah, that's huge.
I was at a meeting recently for this gene therapy company, and they talked about a person who took their gene therapy and they were able to walk down the stairs, go to the corner store, and get a cold drink. That was the outcome that this person pointed to that they really wanted. It's certainly remarkable with gene therapy, but with physical therapy, these are things that we can do for ourselves without any super hardcore medical intervention or taking pills or gene therapy or whatever it is. The power is in our hands to make that stuff happen. So I will let listeners know that Dr. Gretchen Hawley has an amazing YouTube channel. And anyone can go on there and just watch and do the movements or exercises in their own time and improve themselves.
One reason that I decided to launch more virtually, not just in person, is because I remember one of the very first support groups that I went to, my goal was to share some slides, educate on MS, specific physical therapy and treatment management and strategies. And I truly remember feeling so silly. Like, here I am, I don't have MS. Who am I to educate on MS management to this room full of people that live with MS? And so I was nervous going into it, thinking like, they already know this. And I was astonished that 95% of what I educated on, they had never heard before. And it just blew my mind. Like, what? I just thought this was basic stuff, yet no one has learned these things. And so that's really when I made it my mission to start sharing this information more publicly so that you can learn it, because so many of the things that I teach, as you just said, Kyle, are things that you can do right now. Like there's an exercise you can do right now in your home that can help you stand up from low surfaces if you just know what it is. Or there's information on heat intolerance that if you just knew why it was caused and that it wasn't the temperature outside all the time, then you could implement it and you feel better and less fatigued. So that's when I started all of my, YouTube, social media, my online program, was to get that out. There's so much that you can do on your own.
All of these things that you just mentioned, like standing up from a sitting position or heat intolerance, or like I saw a video about balance. And those are all things that are not necessarily specific to MS. We all have those challenges in a bunch of different conditions and diseases.
Absolutely. And as I mentioned in the beginning, I'm such a visual learner. And so that's also my favorite way to teach because I'm the type of person where if I read about an exercise, I might find it interesting, but I'm probably not going to do it. But if I see someone teaching me exactly how to do it and telling me why it's important, because I'll be honest, there's a lot of neuro-based exercises that are very boring. They're very functional. It will help with your mobility and strength and walking and balance, but they're boring. So if you tell me why it's important and how it's going to help, I'm so much more likely to do that. And that's what I can do on these YouTube videos, my Instagram, Facebook, all of that. So that's my desired form of giving information as well.
That makes me think of the dentist, right? Which I happen to go to today. But it's one of those things, save you money as a kid, or flossing. If you don't know why you're doing it, why do it?
Or math.
Like, some of the subjects we study in school, you think, I'm never going to use this. Like, what's the value? But I think you make a good point, and I'm glad you say it that way. If you know why you're doing it, it's a whole lot easier to stay motivated and to actually follow through.
Yeah, and I think one thing, too, that makes it easier to stay motivated and follow through is to go back to what we were talking about when it comes to goal setting and thinking about the deeper meaning of what it would do for you if you saw those improvements. So again, so many people will say that their goal is to get stronger. And my follow-up question is always, how will you know if you're stronger? Like, I can do tests on my end. I can push down and I can grade you a 4 out of 5 strength, but what does that really mean? So I want to know, how will your life be different if you're stronger? How can you tell if you're stronger? And that's when I'll get the real juicy stuff. That's when I'll hear, like, I can climb my stairs instead of going down on my butt, or I can walk to the park with my kids instead of hanging back. And so when you're thinking about your why of why exercise, regardless of what type of exercise it is, think in that way of how will your life improve? What things will come if you see these improvements? And then that is way more likely to push you to stay consistent than because I want to get stronger.
I watched a video and you were shifting weight back and forth between your feet. Mm-hmm. And I totally understand that that's functional and there's a purpose for it. But how do I feel satisfied in that moment, in that workout session, that I've really worked my body?
So I think it's twofold. One is wrapping your mind around the idea that that is exercise. I think most of us grow up with viewing exercise as a certain thing, as being cycling, running, elliptical, Stairmaster, treadmill, jumping jacks, lunges. And so anything that doesn't fall within that, we don't think of as being exercise. And therefore we don't feel successful or like we've met our goal when we complete it. So I think part of it is rewiring our brain around, what does exercise mean? What is my definition of exercise? And what types of things does it include? But then another part of it is actually the physical component. I had a patient come in, it was kind of similar to you. He loved cycling. And we were talking about the benefits of cycling and how it's really great. It's not a functional exercise for walking because you're in a different position, but it's a great exercise for cardio, leg strengthening, you name it. And he was telling me, though, that every time he cycles and he pushes himself to the point that he wants to, he is so fatigued after that he just has to sit there for 2 hours. And immediately my brain was like, okay, let's fix this. And I was like, well, okay, could you do this? I was offering so many different solutions. And eventually what it all boiled down to is him saying, well, yeah, but then I wouldn't be able to bike that long. And that's what I want to do. And I was like, oh, well, okay. If you don't mind sitting there for 2 hours, sure, go for it. Like, who am I to change that if you're okay with it? So I think it's also a combination of do what you want to do. That's going to keep you motivated and excited. And then sprinkle in some of these functional exercises when you can.
Got it. Yeah, that makes sense. You didn't know that you were getting into like a personal PT session right now, did you?
You mentioned functional exercises, and everybody's got different stuff, right? Mm-hmm. Is there a exercise or two that you recommend everybody should do every day? A cardiologist will tell you, go for a walk, right? Walk around the block every day. Is there something like that maybe you as a PT would say, everybody should do this for 5 minutes every day or something?
The exercise that I think everyone should do is what I call marching. And you can do this in so many positions. You could do it seated or standing or lying down, lying on your side. But essentially, you're just bringing your knee up towards the ceiling or up towards your face, depending on what position that you're in. And it's a hip flexor strengthening exercise. And the reason that's one of my favorites is because almost every movement that we have to do throughout the day, when we're not just sitting and resting, requires that we use our hip flexors. Even if you're sitting most of the day, scooting forward and backwards requires you to use your hip flexors. Walking requires hip flexors. Stair climbing, getting in and out of bed, transferring from one surface to another. Almost every movement requires hip flexor strength. So that's one of my favorite strengthening exercises. But equally as important, when someone asks me this question of what's the best thing, like what should I be doing? It's so varied, as you just mentioned, Sean. Like there's so many different goals out there. So my favorite answer is the thing that you should do every day is the thing that's hard. And you want to do that thing that's hard as an exercise, which might mean that you make it easier at first, but then you're building up to actually doing it regularly. For example, let's say standing up from your couch, which is low and squishy, is really hard for you to do. Then you should practice standing up from your couch as an exercise. But if it's too challenging, you're thinking, well, I can't. That's why it's my goal. I can't do it right now. Put an extra cushion there so that it's 2 cushions instead of 1 and see if you can do it there. If that's still too challenging, pick a different surface in your home that you can stand up from. Maybe your bed is taller than the couch. So maybe you practice standing up from your bed. Whatever surface it is, practice the thing that's hard as an exercise. A lot of people forget that, and they just think of exercise as like individual things, which is important, but do the thing that's hard. That's the number one advice I would give.
I appreciate that you clarify it with make it easier at first if you need to.
Yeah.
And normally I work out often, but for whatever reason, 3 months now of not working out. And I finally got back to the gym this last week, and I'm committed to going at least 4 times a week. And I went to do some arm curls last night. And, you know, in the past, I think maybe 25 or 30. I started with 15s last night. And I felt like it, I felt weak.
Yeah.
But I'm like, it's just a matter of time before I get back up to a higher weight.
Yeah, I think it's so important because, again, we grow up with this idea of not only what exercise is, but what progress is. And if we feel unsuccessful, we're less likely to jump back in when we fall off, and or we're less likely to stay consistent long enough where we can get back to where we were before. And so I think I'm actually writing a book. One huge chapter is on how to modify, because whatever type of day you're having, or if something happened physically where you can't do what you used to do, you have to have a way to modify. Otherwise, you're not going to do it at all. And then you're going to get weaker and weaker and weaker over time. So there's so many different ways that you can modify and actually continue doing whatever you can to continue to build strength and balance and mobility. So having those options and also mentally being okay with being a beginner again, I think is key.
Yeah, that's a big challenge. Mentally being okay with it.
Yeah, I know. It's physical and mental, 100%.
Starting small and knowing that you're doing this for yourself to improve yourself. It can be mental and emotional. All those things play into physically making yourself a better person.
One of the biggest rewards that I get from working with my one-on-one clients is not necessarily when they tell me their physical progress, like they can stand longer, walk longer, they're not falling as much, but they also tell me that they have more confidence, or they're feeling more empowered, they're feeling more independent. And for me, that is really what I want you to feel, because if you're feeling more confident, you're going to exercise more, you're going to present differently in life. And so it's that emotional, mental component just as much as the physical.
Not all of us have a Dr. Gretchen Hawley. Most people have experienced that their physical therapist does not know their disease or does not focus on their individuality and this physical therapist is like taking care of 5 people at once, right? They're taking care of you, and then across the room they yell, hey, do 10 more of those or whatever, right?
Yeah.
How do you suggest that we take control of our health and help educate our physical therapists about our condition and about our individuality and really help make a plan that fits us personally?
Part of it is on you, but part of it's on them. And if they are willing to listen and to accommodate. But on your part, one of the things that I find the most valuable is, again, the goals, the very specific goals. And so one thing that you can do with your PT is be extremely specific with every goal that you mention. So for example, if you have a goal of climbing your stairs easier, what does that mean? Do you mean pulling up with your arms less? Do you mean better balance? Do you mean by bending your knee more? Like how do you want your stair climbing to improve? Same with walking. What about your overall day? Do you want to be easier? Getting dressed? Getting out of bed? Like what specific things can you mention? That should give them a whole lot of exercises that are very specific to you and your goals. So get very specific with what you're telling them your goals are, for starters. And then secondly, if you can, educate them on the important parts. One important part that I stumble across a lot with my clients is that their in-person PTs push them to fatigue, which you should never do. If you push to the point of fatigue, you likely have poor quality. And if you keep doing poor quality, the neural pathways that you're strengthening are not the neural pathways you want to be strengthening. Good quality is really important when we're talking about functional exercise. So if your PT is pushing you beyond that, or you're getting overheated from exercise and that's causing some of your heat intolerant symptoms, you have to educate them on those things, unfortunately, because they probably won't know about it. So those are the two things that you can do. But from there, it's really up to them to listen and to accommodate and modify as needed. There are fewer and fewer PT clinics that are just one-on-one. That's one reason why I branched off on my own, is because I didn't want to be one of those PTs that have 5 patients all at the same time.
Yeah.
But there are some, so, maybe do some research, see around you what clinics are there where they do just one-on-one or only 2 people instead of 10 people at the same time.
Awesome. I appreciate the practicality of the things we deal with all the time. Dr. Gretchen, can you tell us where our listeners can find you and tell us a little more about this book?
Most of my stuff, if you're looking for anything, is called The Missing Link. So that's the name of my online program. It's the name of my podcast. It's the name of my book. So if you search for The Missing Link, it's spelled MSING link. So if you search for that, you'll be able to find everything. Or you can find my YouTube, my Instagram. Most of that social media stuff is Dr. Gretchen Hawley. And across all of those platforms, my main goal and the content that I produce for them is to teach you these things exactly that we've just talked about, the exercises and strategies, so that you can actually see a difference in your mobility and your function. So many people tell me that they were doing strengthening exercises and walking balance exercises, and they did get stronger, but their walking didn't improve. Or their balance got better, but their function in some way just didn't improve. And so I'm trying to bridge that gap. And that's what I share all over social media, in my book, in my online program, all the spots.
It seems to me that you are in this line of work because you want to help other people, which is refreshing. Because when you think, or at least when I think of doctors and therapists and other people that are maybe in this space, at one point, maybe that's why they got into it. They want to help others. But at some point, they quit listening. Mm-hmm. They quit trying to educate themselves. They quit really trying to modify based on one person's situation or circumstance. And I just find it encouraging and refreshing that either A, you're not that person, or B, you're not that person yet.
I hope to never be that person. Yeah. Each person that I work with, whether it's one-on-one or in a group setting, my favorite part is that brainstorming and that listening of, okay, MS and other conditions are not the same for each individual person. How can I help you? Because it's probably going to be different than the next person, the person from before. Yep. So yeah, there's in order to keep your MS specialty certification every 5 years, you need to have at least 75 hours of continuing education, whether that be attending conferences or teaching. And the last time that I hit mine, I was totaling up my numbers and I had like 2,500 hours, just because I not only love treating people, but I love learning and staying up to date with what is newest, what's coming out that can help my clients. So it's definitely a passion of mine.
Well, I personally don't like people that just do bare minimum, so I appreciate you going way above and beyond. That's amazing.
Yeah, absolutely.
Dr. Gretchen Hawley, thank you so much for joining us today. We're going to put links in our show notes for everybody to find out more about you, to find all your social media. We encourage everyone to check out Dr. Gretchen Hawley's YouTube channel. But really, once again, we just appreciate you coming on and sharing with us today. Thank you.
Thank you for having me.
But Kyle, I've never seen Dr. Hawley up until you brought her forward. So great find. I'm really glad you helped connect this podcast to what she's doing. What an incredible interview. I certainly find a lot of value in her advice to do the hard thing. Because there's so many, that could be a million different things. And as long as you're committed to working toward it, whether it be, a little bit every day, a couple times a week, making it easy, adjusting, working at that hard thing is probably some of the best advice I've heard from a physical therapist. Maybe from a human. I mean, even that extends so far beyond physical therapy as well.
Dr. Gretchen is obviously an expert in physical therapy, but there's so much to be gained from her just about the mindset, right, as you're talking about. And we're going to be able to benefit from that in her book. It's going to be available for pre-order soon, so keep an eye out for that.
As listeners know, we wrap up every episode with some notes of gratitude, or what we commonly refer to as thank you notes. We believe in the power of gratitude and expressing thankfulness. So, Kyle, who's your thank you note going out to today?
My thank you note goes out to my teammates from the 5-borough bike tour. As I mentioned earlier in this episode, it was just so much fun, far beyond just a bike ride. It's the banter back and forth, and it's the jokes shared and the inside things, and the car ride to New York City, and the excitement. And it was a really fun group to experience that ride with.
That's wonderful. Yeah, events like that are certainly hard to beat. Even if they're hard, it's still fun being around people you know and love and share life with. So I'm glad to hear that it was a fun day for y'all. I'm saying thank you to a family of new friends for me. Kyle, you'll meet them in a few days. But Chris, Tierra, Chris Jr., Kahlua, and Kai, they're I would say young family, although mom and dad are my age, right? We're very close in age, but they have young kids. And what the oldest son has FA, Chris Jr., and we've got connected over Facebook, and we had the opportunity to meet about a month ago for lunch, and then we had dinner last week. So it's been fun to get to know this family. So wonderful folks that I'm excited to share life with moving forward. So Chris, Tierra, thank you for being cool.
I'm really looking forward to meeting them. This episode is brought to you in part by Reata Pharmaceuticals. Thank you to Shelley and Dr. Gretchen for adding such incredible value to this episode. Check out our show notes for links to Dr. Hawley's resources. Share with a friend, and please subscribe to this podcast. Until next time, keep living with urgency. Thank you for listening to the Two Disabled Dudes podcast. This show is possible with your support. Visit twodisableddudes.com to donate.
Connect with us on Facebook, Twitter, and Instagram. And be sure to subscribe on your favorite podcast app.